Hello, welcome to my channel. It's Brigid, your snake diet warrior. I am doing a video tonight on GERD. It has been requested from me to do because I suffered from GERD for many years, and I am now free and cured. So people have asked me to explain a little bit more about GERD, my experience, and so I'm going to do that today. Just to let you know, I am not a healthcare professional. This is information that I've obtained over the years of being a GERD sufferer. So what I'll be talking about tonight is what GERD is, and acid reflux and what causes it, self-care and lifestyle changes that can reduce your symptoms, medications, natural remedies, your diet, trigger foods and good foods for if you're suffering from acid reflux and GERD. Talking about eating habits to reduce your symptoms. A little bit about my journey and how I came to full recovery. I've also been asked many questions about swallowing issues. I do have some information on that I'll share as well. And I'll just summarize what we talked about and hope that this will be very beneficial for you. GERD is an acronym for gastroesophageal reflux disease. It's a digestive disease where the stomach acids come up into the food pipelining, as they call it, and irritates that and causes a lot of problems for people with pain and discomfort. It's very common. There are 3 million new cases every year in the United States of this. The cause, what they claim is the cause, is most often a weak or poor working muscle sphincter at the end of the esophagus. The way you can eat and certain foods may cause it, extra weight, self-care, and lifestyle changes. Elevating the foot of your bed 4 to 6 inches or sleeping with a wedge pillow at night can help prevent any of the gastric juices to come up into your food pipe and irritate those linings and your throat linings. That is one of the lifestyle changes that you can do. After you eat, 3 to 4 hours before going to bed would be really important. You want to try to get your food as digested as possible. And then when you go to sleep, it's less likely to come up into your food pipe. Don't wear tight clothing. Tight clothing causes abdominal pressure, and that abdominal pressure may force some of the acids up into your food pipe. Don't smoke. That's a big one. Do not smoke. Food elimination. You'll want to look at different foods that might be causing more symptoms and eliminating those. Weight loss can be very beneficial. If you have a lot of extra weight, it can actually cause pressure in the abdominal cavity and push acid up into the food pipe as well and into your throat. Medications. There are some medications you can buy over the counter. There's Tums, Rolaids, Mylanta, and then you've got the PPIs, which are the proton pump inhibitors. Esomeprazole, omeprazole, Prevacid. Those are just a few of the medications that can be bought over the counter, or they can be prescribed to you. Those are just a few of the examples that you can get for medications. I do want to warn you about some of the side effects that can be quite alarming. Is diarrhea. Not only diarrhea, you can have nausea, constipation, irregular heart rates, and it can also damage your kidneys. So be careful. Also, these medications can interact with any other medications that you're taking. So, look up any interactions on the internet or contact your pharmacist or doctor about that. They can give you much more help than I'm going to give you in this video about medication interactions. Natural remedies. Some of the natural remedies is apple cider vinegar. Apple cider vinegar you can use diluted with water and drink before meals. It'll reduce your symptoms. Start with apple cider vinegar in the morning and a couple times a day. I recommend like 2 tablespoons and just drink it as a quick shot. Or you can dilute it with water and drink it. I do want to warn you about apple cider vinegar. It can be corrosive to your teeth. So if you are worried about that, you can, drink it and then rinse your mouth, or you can use a straw to kind of bypass your teeth. Some people do add apple cider vinegar to their snake juice, and if you do that, just remember you might want to have like sucking on a straw and avoid contact with your teeth. Another natural remedy is baking soda. It's almost everybody has it in their kitchen, and it's very inexpensive. One way it can be taken is 1 teaspoon per 8 ounces of water. Or I like to do it as a shot. I put the half a teaspoon to a teaspoon in room temperature water, and I just chug it. So maybe 3-4 ounces, I'll mix it, chug it, rinse the glass, drink that. That'll calm down some of the gastric juices in your stomach as well. There are related conditions that GERD naturally kind of goes with, such as obesity, like we talked about, being overweight, forcing, pressure into that abdominal cavity, pressing the acids up into your throat and into your chest. Esophagitis, hiatal hernia, which I'll be talking about a little bit more later. Barrett's esophagus. Barrett's esophagus, to me, Barrett's esophagus is very serious, because once you have gastric juices constantly going up into your food pipe, repeated exposure to stomach acids into your esophagus, you may not notice the heartburn, but Barrett's, you have to have the repeated offense there, and when they go in and do an upper GI or esophagram or endoscopy, they go in and they'll take biopsies of any of the tissues that are damaged, and with Barrett's you're more likely to start watching for cancer of the esophagus, cancer of the stomach, so and mostly of the esophagus. So you want to be real careful about acid reflux, and there is something called silent GERD, where you might get pain under your breastbone, but it's not feeling like the acids, like reflux and that type of thing, and that can be dangerous too, because then you aren't taking the precautions that you need to take with such a dangerous thing as GERD and repetitive burning to your esophagus. Gastritis, metabolic syndrome. Metabolic syndrome is a cluster of symptoms that increases your chances and risks of heart attack, stroke, and diabetes. Laryngitis. A lot of people who get laryngitis don't even realize it, but they have GERD or reflux that has irritated their voice box, and they're unable to speak because of the inflammation. Asthma is a related syndrome. Stomach ulcers, bulimia, throat pain. I'll talk a little bit about bulimia a little bit later in the video. There are things that within your diet that you want to be careful about. There are trigger foods, and some of those trigger foods are, briefly, and they're not all inclusive, of course, is increased fatty foods. You want to be careful of fried foods, tomatoes, citrus fruits, chocolate, darn. Garlic, onions, spicy foods, caffeine, carbonated drinks, mint, sausage, sugary drinks, and there's many more. Your body might be responding something differently than what my body would respond to. Some of the things on the list of good foods that are not offenders, that will not make your GERD or reflux any worse, are examples: chicken breasts, especially with no skin, sauteed or baked would be the best. It's the least fatty meat that I can think of at this time. Water. Water is great to have throughout the day, and water will reduce the amount of gastric acids. Ginger tea, or chewing on ginger, dried ginger, if you just chew on that, some of the juices will go down and calm the stomach. I remember as a child, ginger ale and the 7-Up doesn't have ginger in it, but those are things that calm down the stomach when you had a tummy ache, and that was something that my parents or some other parents would give you because ginger ale has ginger in it. Watermelon, cantaloupe, honeydew, those are low acid fruits. Brown rice is a complex carbohydrate that won't increase gastric juices, and the good thing about that is that it is a complex carbohydrate that will give you extra fiber, and that's really important. Oatmeal is another one. Be careful what you add to it, because that whatever you add to it can, disrupt the gastric juices and cause you to have reflux. Potatoes are safe. Olive oil, keeping it light. Lettuce and celery is easy on the stomach. A lot of times we can eat some vegetables that cause extra gas, and extra bloating and gas can cause more pressure to the stomach and force gastric juices into your food pipe. Fennel. Now, I don't know much about fennel, but they do recommend fennel. You can roast fennel, and you can also chop it up raw and put it on a salad. Eating habits that we need to change up a little bit to reduce the symptoms. And some of those eating habits is, like the first one I would talk about is chew your food slowly. Anytime you go fast, you gulp in air, and we don't want that air inside of you. Chew your food well. And as we all learned in grade school or high school or junior high, the first part of digestion is in the mouth. The saliva starts breaking down food, and chew it really well. And please don't wash your food down with liquids. I have a hard time with that. I'm not sure why. It probably is just habit. So I try to keep aware of that. And also during meal times, stay as relaxed as possible. Stay away from stress. Don't grab your food and run. Stress tightens everything up in your body. So, stay away from, grabbing and running your food. After you eat, stay upright for at least 1 hour, and it's best to have 3 to 4 hours between eating and going to bed at night. There's another recommendation to walk for about 15 minutes after a meal. And if you can't walk, or you just don't have time for it, if you're going up and down doing stair steps, doing laundry, cleaning your house or whatever, those type of things will help you get any extra air out of you and calm things down. So we're not talking about running, we're talking about gentle walking. Always sleep on your left side. With GERD and acid reflux, you should be sleeping on your left side, because of the way the stomach is shaped, it's in a bean shape, and when you're on your left side, it's less likely to have the gastric acids going up. If you sleep on the right side, it is perfect for the gastric acids to naturally go up into the food pipe. So remember to sleep on your left hand side. It's very rare that you can go up. Another recommendation is to keep a food diary. as you try to eliminate foods or find a pattern in what is going on, you might want to keep a food diary. So like, for example, if you have coffee in the morning and you write down that you had coffee, and then you go out throughout your day, morning, whenever you had the coffee, and write down if you had symptoms, if any. Even in the late afternoon, coffee can give you some problems as well. That's just a very simple example, but keep a food diary and pay attention to what foods might, trigger you for more gastric juices. Keep a diary about how close to, going to bed you ate. Keep a diary about, any stressors that were going on during the time that you ate. Those things might be very valuable to you in the long run. My journey with GERD and how I cured it 100%. And I can guarantee you this has been a life-changing experience for me. First of all, fasting helped tremendously reduce the amount of acids that I produced. And during the refeeds, I paid attention to what kind of food was permissible or not. And the things that at Fat Camp that Cole recommended for me to eat were not, at the time I didn't think about it, but they were not acid producing foods. And it was just seemed like a very natural choice for a refeed. Losing the extra weight that I had on, that was pressing, and compressing me in the abdominal cavity, that had helped quite a bit to be very aware that that changes how you completely function. I had a hiatal hernia. The doctors believed that I developed a hiatal hernia in my 20s when I had an eating disorder called bulimia. And in bulimia, there's different ways of purging, but my type of bulimia was I was doing the eating the food and then purging by vomiting. And they believed that by the violent vomiting and the forceful vomiting I was doing, that I, did so much pushing that I created the hernia for myself, which then, increased my acids and caused some damage, and it's permanent damage. And, I had to live with that. In my 30s, in my late 20s, I had my son, and I no longer purged anymore or binged and purged. I ceased to be bulimic at that time, and there took a lot of prayer and a lot of things on that end. But anyway, some of the things that happened with a hiatal hernia and can happen to you with a hiatal hernia, my blood pressure was greatly increased. My heart rate was high, even at rest. My lips would turn purple with very little movement or exertion. When you think about it, everything's up in the chest cavity. Well, that compressed also on my lungs and my heart. Shortness of breath. I had a lot of shortness of breath. And then I had something called esophageal spasms. They were so extremely painful. I remember my mother having them, and she swore up and down she was having a heart attack. And yes, it can be very deceiving. And yes, I've gone to the emergency room when I've had esophageal spasms that wouldn't stop. And since I knew about them, I wasn't quite as afraid. I mean, it wasn't less painful, but I wasn't quite as afraid of them as I would have been if I hadn't seen somebody have many of them during their lifetime. I did use apple cider vinegar in my snake juice. That is something that I believe helped me throughout the day, keep my stomach acids pretty stable. I also did AM shots of baking soda, and I used the water at room temperature. A lot of people who have heart problems or esophagus problems, drinking really cold water can cause everything to tighten up real quick. So it doesn't happen to everybody, but quite often it will do that. So I use room temperature water with maybe 4 ounces of water with a half a teaspoon to a teaspoon of baking soda, and I drank that as a shot and then a little extra to rinse it out. back to the hiatal hernia. I wanted to tell you some things that I did to help with symptoms from the hiatal hernia, which caused the acid reflux. I did a little reading, and I started this at Fat Camp because Cole and I talked about there were different methods that you could do to help with a hiatal hernia. And what I did was, first thing in the morning was drink about 6 to 8 ounces of warm water, wait about 5 to 10 minutes, not much more than that. I would stay under 10. 5 is probably the most ideal. And what I would do is raise up on my toes and then drop to my heels as hard as I possibly can. Just boom. Do that 10 to 15 times. And the hope is that while you're doing that, the hiatal hernia, which is part of your stomach sticking through, the force will cause it to be pushed back down as much as possible. After the second day of doing that, my symptoms reduced by 50%, as long as I kept doing that every day. I was a little surprised because I had read that you need to jump from a substantial height, and at that time I wasn't able to do acrobats like that. So, you know, the toe to heel drop was sufficient for me. I didn't have the stability to do anything else, but that was very helpful for my hiatal hernia at that time. I had tests. I had an upper GI. I had an upper GI done, which is a scope, an endoscopy, and they also took biopsies when they were in there. They saw, you know, corroded, eroded tissues in my stomach and my esophagus, and they took that. You know, they wanted to make sure that I didn't have Barrett's or the beginning of some form of cancer. My tests did come out that I had gastritis. Knock on wood, I was very grateful that it wasn't Barrett's esophagus. So, in the end, what really cured me, because I probably went beyond the point of any return with my GERD and acid reflux, is the surgery I had over this last Christmas 2019. And I had my hiatal hernia repaired, and then I had a procedure, fundoplication surgery. And what that fundoplication is when they take the fundus part of the stomach and wrap it around the bottom part of the esophagus as tightly as recommended, and that replaces the ability, you know, the sphincter that has stopped working. On me, the surgery was 100% effective. I had to follow a lot of rules though. I went about a week and a half with liquids only. I could only use a baby spoon to take those liquids. I couldn't drink a lot. I had to do it very slowly. I also followed a soft food diet, pureed diet, for the week and a half after that. And then after I had my follow-up 2-week appointment, they said I could start introducing some solid foods. So that's my story, my GERD story, and my cure for the hiatal hernia. It's been life-changing because I can breathe better, my heart is better, and also my blood pressure the other day was 107/72. And that's just from, you know, reducing what was up in my chest cavity. And yes, it's been life-changing for me. Swallowing issues. I had a lot of questions about swallowing issues, and I can only give you the information that I've kind of looked up, things that I already knew, things that my doctor has talked to me about swallowing issues. Some people have issues with GERD and swallowing. With GERD and swallowing, just GERD alone and acid reflux, you can have a lot of irritation in your throat, and that inflammation and irritation will make it hard to swallow alone. The other things that you want to take into consideration are, you know, tonsillitis, hiatal hernia like I had, And also, you don't want to leave out, your thyroid may be inflamed or swollen. You might be at the beginning of, a thyroid disease. So when that swells up, definitely there is a problem with swallowing. With lifestyle changes, dietary changes, weight changes, medication, natural acid reducers, they will help you. If you haven't gone to the point of no return, you can heal the irritation and of the esophagus. You may need some medication that will, lower your acids so that you can heal, but it takes time. So please be patient. Those tissues are so very tender, and if you continue to eat, just the friction of the food going down will cause you to have some extra time recovering. And also, I would feel incomplete if I didn't encourage you to do some fasting for healing. But please follow, the instructions from your doctor. Pretty much GERD, they say, you can self-diagnose, but you want to follow up with your doctor if you've had it for a long period of time, because you don't want to run into troubles for long-term irritation and erosion of your esophagus. Thank you for watching this video, and if you learned anything from it and you like it and you can share it with somebody, please subscribe, like, and share. Until next time, everyone, take care. God bless.